I've been working as a frontline doctor since the very start of the pandemic, which actually has been more than half of my entire medical career. Currently, I am working as part of the ITU team, predominantly covering the high dependency unit, where we have some of the sickest patients in the hospital. Many of them are on ventilators, struggling to breathe. And with this, it's a very physically, emotionally challenging time. It's the unpredictability, the fear, the anxieties, but I'd say the unknown that is probably the scariest thing for me right now.
I know you're on night shifts at the moment, but what are the sort of problems that you're facing every day when you're trying to do your job?
The main problem is that we have high numbers of patients who are deteriorating at such high rates in such high numbers as well. This is because we've got more patients being admitted through A&E, patients who are needing admission to the wards, but also to the intensive care units as well, requiring ventilators and additional support, for example. But not just that, we have to bear in mind that we have increasing sickness in the hospital as well. Doctors, nurses, the admin, the security, the porters, and the domestic staff as well. Across the board, we are being overwhelmed and stretched and working at above maximum capacity at the moment.
And what is it like, Kishan, when you have to tell somebody that their loved one could die because you are the last people that that person may well see?
We're having to phone up relatives of patients and tell them that their mothers, their sisters, their grandmothers, their fathers are very, very unwell. They could be on a ventilator. They might not have seen them in weeks. And to tell them that the prognosis is poor and there's a high chance that they'll pass away in the next few hours or few days is just so upsetting. And it's having to do this on a frequent basis that just makes me very, very sad. And it's causing a lot of emotional strain on all of my colleagues.
Now, I know you've had coronavirus yourself and you've
Yeah.
also now had the vaccine. What is your
Yeah.
message to the public about vaccinations?
So having coronavirus itself can affect people in very different ways. Fortunately, my experience was with mild symptoms. I had a cough, shortness of breath, and fatigue that lasted a few weeks. Um, but having seen patients who have been much more unwell than I was with severe symptoms, I want to encourage everyone to have this vaccine whenever they're given the opportunity, just because this is the next step to get us back to our normal lives.